Now, welcome to my class, and this is the class of Organon of Medicine. Basically, for all the students, practitioners who want to revise, and the teachers who want to have a very sweet discussion. So, let us start with a PowerPoint presentation, as because this will help the student to read the book. Basically, what I will do, that I will take the book along with it. For my students, I can tell you that please keep the book with you, and the book is, first of all, obviously the book of Dr. Samuel Hahnemann, the Organon of Medicine, 5th and 6th edition. So this is Organon of Medicine, the 5th and 6th edition, translated by William Borick and R.E. Digen. R.E. Digen in the 5th edition and William Borick in the 6th edition. And this is the inner page, the Organon of Medicine by Samuel Hahnemann, and we can see that here it is written that Audis affair, that is the meaning dare to be wise, and translated from the 5th edition with an appendix by R.E. Digen, and with additions and alteration as per 6th edition by William Borick, and an introduction by James Cross. Now let us come to aphorism number 1. Now therefore aphorism number 1, it says that the physician's high and only mission is to restore the sick to health, to cure, as it is termed. So this is the first word of the Organon of Medicine, that main text part, that is the aphorism number 1. First of all, think that what does it mean? The physician's high and only mission is to restore the sick to health, to cure, as it is termed. This means that the physician's main aim, the main whatever is the duty, what he needs to do is to restore the sick back to health. Restore, that means that it taking the sick person back to his healthy condition. And as it is we can say that this is called the cure, and as it is termed, it means as it is termed in the Organon of Medicine. So I repeat, it is a very simple form, nothing complication is there. The physician's high and only mission is to restore the sick to health, to cure, as it is termed. It means that the physician's main work, or what he is going to do, what is his object, his duty, his aim, is to take the sick person back to his healthy condition, what it is called as cure. And what we can say regarding this, what is this cure, how this is written in this Organon of Medicine. Following this, we can cure a person. So aphorism number 1 is very simple, that is the physician's mission is to cure a person. So this is the aphorism number 1. I have cropped it out, and for the students I can tell that you have to learn by heart this line. The physician's high and only mission is to restore the sick to health, to cure, as it is termed. Now regarding this thing, what I want to say, when I go to the explanation, first of all, reading the aphorism, you can say that first of all you have to understand what does it mean grossly. So it means that our duty, mission, object, aim is to cure. Okay, it's to cure. What we can say that restoring the sick to health. So what is a cure? Restoration of the sick to health is cure. And what is as it is termed, as it is given in the Organon of Medicine. Now come to the explanation of this line. Now we are if you see this line of aphorism number 1, we see that the physician's high and only mission, pick up the, now for the students, pick up the words, the physician, then high, only, mission, sick, health, cure, as it is termed. So if we break this aphorism to understand it separately for preparing for the examination, or if you want to understand deeply, we have to take a vivid look into this aphorism. So let us see the main theme of the first aphorism is that what is the physician's mission? What is the physician's mission? Because the meaning or the sense of aphorism number 1, it tells us that the physician's mission, what is your mission? It is to restore the sick, to help, to cure. So your mission is to cure. Now what does aphorism number 1 says? Aphorism number 1 says about the mission of a physician. Now let us see mission. Mission is a word which was translated by Dr. R.E. Dajan from the original German word Beruf, which was translated as we can see in this slide. The mission, Hahnemann's German word Beruf has been translated as mission by Dajan. Calling by Wesselhaft, Decker, Hell, Kunzli and Fink, as object by Hell and Dajan, and as aim by Dajan in Appendix and Wheeler. So we see that we know that the Organon of Medicine was written in German language by Dr. Christian Friedrich Samuel Hahnemann, and this Organon of Medicine has been translated by various authors in various times. Of these various authors, the 5th edition of Dr. R.E. Dajan, Robert Ellis Dajan, has been considered as most appropriate for a number of years, as because it carries both the sense and it carries also the proper translation of word to word, line to line meaning. This is the reason why we consider or we accept Dr. Dajan's translation of 5th edition. And if you see the 6th edition, the translation of William Borick in the 6th edition was it is about 95% it has been conserved the translation or the word of Dr. R.E. Dajan. So and there are many other authors, many other stalwarts who have translated this Organon of Medicine. Of them, the word mission has been translated in by various different words by different translators. That is, for example, mission by Dajan and calling. Now calling means what is the inner calling, what is his inner conscience says, what he have to do, what is his we can say that object from within his mind. So calling by Wesselhaft, Decker, Hell, Kunzli and Fink, these all are the great person who has translated, these great homeopaths who has translated Hahnemann's Organon into English. And object, that is, you can see that what is our main object. We have a pathway to reach a complete destination, what we call the object. The object by Hell and Dajan, and again aim by Dajan. So the word Beruf has been translated by various other translators in these words. Now we see that the translation of words of mission, again if we go to something of elaboration, as we have just now discussed about that, from the book of B.K. Sarkar, we can see the word mission seems to be appropriate because the physician must attend his patients with the inner passion to serve and to save, the curing the sick as a holy and ultimate activity of the physician. No other work is important for the physician than curing the sick. All these energies must be focused and bringing the sick people back to the healthy state. The physician is not just a professional who attends his duties for which he is trained, but he must see sick people with humanitarian approach. The physician mission is to protect the life force of his patient, to which the economy gives ultimate importance. He is the guardian of the most precious thing in the world called life. So we see that the word mission is appropriate in one sense, that the physician should not take it just in a professional manner. It is a very much the emotional and humanitarian touch in this word, the mission, as because when a physician he wants to cure a patient, he is dealing with a patient, he must have his very we can say that a high attitude within his mind to do something good for the humanity. And so this word mission has been accepted or translated by R.E. Dajan. and it has been repeated by William Borick in his 6th edition. The thing is that the other translators, they were not wrong. The calling, the aim, the duty, the object, that is also not wrong. But the mission, the word which we want to explain regarding this, the mission, it is a very appropriate word regarding this thing. Another one, that is the aphorism number 1 from the different translators, we can say that we may note here the different versions of the first aphorism. If you see the slide, I am reading it out. In the first edition of Organon was translated by C.W. Wheeler. It reads, "The physician has no higher aim than to make sick folk well, to pursue what is called the art of healing." According to Dudgeon's translation, the physician has no higher object than to make the sick man well, to cure, as it is termed. The section implies clearly that Hahnemann was not unmindful of other aims of the object of the physician, but gave priority to the physician's function of curing the sick. So there are many work of a physician, but to give priority to cure the sick, it indicates that the word mission, it is giving us the priority, it is giving us a holy sense, it is giving us a very good sense of the mind to make a patient cure. So this is the word mission, which we can see in a very appropriate form. From the second edition of Organon, the aphorism seems to have taken a more dogmatic turn, which has served to confuse many of our contemporaries. Dudgeon translated thus: "The physician's high and only mission is to restore the sick to health, to cure, as it is termed." C. Wesselhoff translated thus: "The physician's highest and only calling is to restore the health to the sick, which is called healing." And Dudgeon's use of the term mission is taken by many as lending a religious favor to Hahnemann's writing. Now this is one of the very important topic again regarding the word mission, that whether it is having any religious sense or not, because we often see that the word mission was used by a group of people who is preaching the religion. We call them as missionaries. There are many types of religions in the world who used to preach themselves as missionaries, and they used to call this task as mission. Now the thing is that we have to understand that Hahnemann was a scientist and Hahnemann was not a religious person. So the word mission, there is nothing in this word mission about any religion. We can say that instead the work of a physician is a holy one. The physician should be a holy person, and the physician should be a person who used to do something good to the humanity. And this is the reason why the word mission has been translated. The Beruf has been translated to mission. So this is a page from the Dictionary of Organon by Dr. R.R. Joadhar. For the student, I can tell that there are many books, many reference books which you can read. But first of all, just have an explanation with this book. This is the Dudgeon and Borick, the aphorism. And thereafter we can go to the Dictionary of Organon. There are all the meanings and all the other things of by Dr. R.R. Joadhar. These are other books, Dr. Mahendra Singh and Subhash Singh. It is somewhat translated and redacted edition. It's a very good book which has given very much information regarding the Organon of Medicine. And this is the book of B.K. Sarkar, and there is a part called the Commentary of Organon, which you can read for the explanation. There are many other books for references, which for example book of Dr. Ashok Kumar Das, book of Dr. Nagendra Babu, book of Dr. T.P. Mandal, Dr. Thombre, and many others, Dr. Bhattacharya. There are many other books, but we will go for some authentic books which will help in the cream point. So this is a page which I am showing you from Dr. R.R. Joadhar, Dictionary of Organon. Here it is written, because Dr. R.R. Joadhar, sir, he has passed away about 2 years ago, but sir has been to understand the Organon of Medicine, he had learned German language, and he was a masterpiece of German language. So we can see a glimpse of the German line which Hahnemann has written in his Organon of Medicine here, and it is translated literally: the physician's highest and only work, professional work, task or deed is to make diseased person healthy, to heal, cure, as it is known. So this is a very new for everybody who are reading the common reference book of Mandal sir, Das sir and others, but this is a unique book which we can see that here the mission has been it is directly translated by Dr. R.R. Juadar as the work of a physician. So we are understanding the word that the physician's mission is not any religious mission. The physician mission is a very, very good work, is a very high and holy work for doing good to the humanity, and that is why this word has been taken. Now going to the aphorism in a very short manner. So we have understand the word mission. Now the physician, a person who maintain, promote and restore health, cure the sick and have knowledge about physics. So we see that Hahnemann has used the, according to the translation of Dr. Dajan, the word physician has been used, not doctor, not homeopath. So we, from the beginning of this Organon of Medicine, we are not getting any sort of the word homeopathy in Aphorism Number One, because this is a book for the entire medical science. It is not a book for the only for the homeopaths. So we all are physicians. A physician, a doctor means that he has to just cure a sick, but a physician, the word has something a wider sense, a person who is having the entire knowledge regarding the health, regarding the body, regarding the physics, the entire knowledge in the abnormal condition, that is about the disease, and entire knowledge in the normal condition, that is the normal functioning of life. So this is a physician. So regarding again this we have already just covered it up, the mission. Now regarding this thing, when we are curing the sick, so we have to know some basic idea about the health, the disease and cure. This is a page from the Genius of Homeopathy, the book Genius Homeopathy from Dr. Stuart Close. Here we see that the chapter number 6, life, health and disease, this is just for your reference. The first year student do not need to go very deeply in this book at this moment, but from the second year to the and above, it is a very good reference. Now see that in this beginning there is a short definition of life. Life is the invisible, substantial, intelligent individual coordinating power and cause, directing and controlling the forces involving in the production and activity of any organism possessing individuality. So it is an invisible force which is within the body, and it is a substantial, and it is governing or controlling throughout the body. The life force is present within the body, and all the functions are going on very intelligently, and it is controlling everything including the production activity and every type of the what we call the vital process within the body. And the health is that balanced condition of living organism in which the integral harmonious performance of the vital functions tends to the preservation of the organism and the normal development of the individual. So what we call health, everything which is functioning normally. When our vital force function normally, we can see there is a normal sensation and the normal function which is called health. And it is this is a somewhat a very complete hard but complete definition. It's a balanced condition where all the harmonious performance are occurring within the body, on the vital functions are occurring, and there is a proper self preservation of the whole body. So this is a health. And disease is an abnormal vital process, a changed condition of life which is inimical to the true development of the individual and tends to organic dissolution. So the disease is an abnormal condition of the body, and where it is the, we can see that it is an abnormal condition of life, and there is somewhat a destructive process which is going on within the health due to any abnormal derangement, what we call the vital force, which we will get in aphorism number 11. So when this question of life, health, disease and cure comes, before going to the appendix, let us complete it. So cure comes. So the thing is that the health is a normal condition of the body, disease is the abnormal condition of the body, and restoration of the disease condition to the health is cure. And we can see the word sick has been used in this Organon of Medicine aphorism number 1, because we are not curing the disease, we are curing the sick person, the disease person who as a whole is sick. To be very very simple, that is, we are to cure the sick person and we have to convert him to a healthy person, and this conversion of sick to health is called cure. So this is in overall aphorism number 1. So we can have just a 1 minute recap. That is, in aphorism number 1, this is the aphorism which Dr. Hahnemann has started the text part of his Organon, where he is written that the physician's high and only mission is to restore the sick to health, to cure as it is termed. Here he has directed towards, he has given us an aim, we are given us an object, or he is telling us our duty, and which is a mission to restore the sick to health, which we can call as a cure. And how this cure will occur, he has told in his Organon of Medicine in the next aphorisms, which we have to follow. So it is written that as it is termed. Okay, so this is a very very simple aphorism, there is nothing complication in it, and it is the direction which a physician has to follow from the very beginning. Next, aphorism appendix to this aphorism number 1. Now we see in this Organon of Medicine book, there is one preface introduction part, there is one aphorism part, and after that there is one appendix part which is giving the different informations regarding the different changes within the Organon of Medicine in different editions. So in this aphorism there is just you can see one short A mark in the top where it is written that aphorism number 1. This A indicates one appendix. This, if we go to the appendix page, we see that in the first edition the aphorism stands thus: the physician has no higher object than to make sick men well, to cure as it is termed. So this is just one information to us that in the first edition Hahnemann used this aphorism in this type of language. The physician has no higher object. So we see that, and the translation again it is translation by Dijen. This is the object which you get it, the appendix of aphorism number 1. Now if we see the aphorism, if we come to the aphorism again from the beginning, we see that as it is termed, after that as it is termed, there is an a very short small 1 mark. It indicates a footnote. Each and every page in this Organon of Medicine, if there is any explanation needed, Hahnemann has added a footnote at the bottom of this book. Now what is this footnote to aphorism number 1? For the student, I will tell that in a very short, you just remember theoretic medicine. Now what is theoretic medicine? So what will be our object or aim or mission has been told in aphorism number 1, but what will not be our object, will not be our mission, it is told in the footnote of aphorism number 1. That is, our mission should not be the theoretic medicine. Theoretic, what is this theoretic medicine? Just let us read for just 1 minute this footnote. His mission is not, however, to construct so-called system by interweaving empty speculation and hypothesis concerning the internal essential nature of the vital process and the mode in which disease originates in the invisible interior of the organism. So this line, very important: interweaving empty speculation and hypothesis concerning the internal essential nature of the vital process. It means that you can see by that time there was a lot of study in the medical science, but there was a lot of imaginary studies in the medical science where there is because sometimes I tell Hindi because I am habituated in that in my YouTube lecture to make it anyway. So by that time we see that the internal function of all the viscera, all the organs was not exactly known to the physician, but in many cases the treatment was going on by giving the medicine with its imaginary or hypothetical somewhat platform. The action of the medicine was given unknowingly to many of the patient, and in many cases they are giving the explanation of what is going on within the organism, and it is of no use to the patient. The patient wants to get treated by proper medicine. The patient wants to get cured by treating with proper medicine, not by any lecture from the physician, or not by any speculation or and its explanation to the patient. The see, a doctor comes to a patient and he is giving explanation after explanation of why the patient is having this disease, but it is not used to this ignorant, because he does not want to know that, he wants to get cured. So Dr. Hahnemann has told in this footnote, aphorism number 1, that this interweaving of empty speculation and hypothesis regarding what is going on within the internal essential nature of the vital process is not no use to the patient, nor is it to attempt to give countless explanations. See the footnote. Nor is it to attempt to give countless explanations regarding the phenomena in diseases and their proximate cause, which must ever remain concealed, wrapped in unintelligible word and an inflated abstract mode of expression, which should sound very learned in order to astonish the ignorant. Because you see that a doctor is explaining, suppose a patient is having a belly ache, stomach ache, and the physician has examined him and is explaining, you might have this type of stomach bed inflammation, you might have a duodenal ulcer, you might have this type of stomach cancer, etc., etc. Is going on telling, and the patient is watching the physician that please doctor, give me the medicine, I want to get cured, I do not need any explanation. So this is the thing which we have to understand is in this and he is also saying that, oh, the doctor is having so much knowledge and he is very astonished from his knowledge, but what is the work here? Why the sick humanity sighs in vain for aid, he wants the treatment of such learned reveries. These reveries, which means that countless imaginary explanations which has no connection with the main fact, to which the name the theoretic medicine is given, and for which special professorship are instituted. So there is a lot of theoretical knowledge regarding the disease, the medicine, the body, but many of the knowledge are useless because it is not properly applicable to cure the sick. So Hahnemann has told that we have for this we have had quite enough, and it is now high time that all who call themselves as physicians should at length cease to deceive suffering mankind with mere cease to deceive mankind with mere talk, and begin now instead for once to act, that is really to help, to cure. So it is the time for the physician to stop giving this type of talking, stop giving this type of explanation, and deceive the mankind is deceiving. It is going for giving a false type of a wrong method. It is not needed for the patient. The patient need proper aid, which we need to give. So this is the footnote of aphorism number 1. In very short, we can understand that theoretic medicine which is not to be given to the patient, and this is what is the theoretic medicine. You can give the definition from the interweaving empty space, second line, interweaving empty speculation and hypothesis concerning the internal essential nature of the vital process, and the countless explanations which the physician used to give to the patient, which he does not need. So the patient needs to be cured, and he needs a proper treatment which we need to give. So this is this aphorism number 1 and its footnote. Before going to the questions for the students, we just have a recap or overview of the whole aphorism. So you can see that the physician's high and only mission is to restore the sick, to help, to cure, as it is termed. So we have got we have already discussed about the word physician. High is a word which indicates that the work which a physician is doing, or the mission of a physician is a very noble one. There are many professions throughout the world, but the profession, or we can say the profession of a physician, is something different, something very very important, something is for the betterment of humanity, as because the physician is having the duty or mission to cure the patient, to cure the sick people, to give relief to the suffering. So we can say that this work of a physician is of a very high category, and the mind, we can say that the mind of a physician as a person, the work or the action he does, everything is in a high quality. So this word high explains thus. Next, the only is something that we have to understand here, that only mission, it does not mean that the physician has only the work to cure. A physician has many work to cure, many work, but the most important work is that to restore the sick to health, to cure. Because we see that many work, what are the many works of a physician? A physician gives advice to a patient, a physician gives a proper legal advices, he can give the evidences in many type of autopsy cases, he can give the mass awareness whatever regarding the epidemics, pandemics, etc. Prophylaxis is also another important work of a physician. Study and researches regarding new medicines and diseases, these are also work of physician. But the most important work of a physician is to cure the sick. So this is the thing, the word only is given here to give more importance particularly to this work of cure. We can take one example. Suppose during the examinations we often tell the students that presently your only work is to study. Now we tell like that, it does not mean that the only work is to study, does not mean that he will not sleep, he will not eat, he will not do any other, he will not talk, it doesn't mean so it means that the most important work he have to do now is to study. Similarly, in this aphorism, the word only indicates the importance of the mission, that is the cure, it is importance of the cure. Next we are seeing that restored, that is restore, to bring back to the previous condition. The word sick means the whole person is sick, the whole disease person are sick, and we are not curing the disease, we are curing the complete person. He should not be diagnosed as cure, we should see the whole patient as cure. And we have already discussed about health, and the cure, that is the restoration of sick to health, is called cure. This is the shortest definition we can say of cure. And if you want to go for a very perfect definition, we can add aphorism number 2 in this aspect, and we can get a perfect definition of complete cure, as it is termed, as it is told in the next aphorisms or throughout the Organon of Medicine. So this is a aphorism number 1. We have explained everything from aphorism number 1, and next we will go to the question and answer for the students. Let us see what type of question can come. Describe aphorism number 1 according to Organon of Medicine. Just go write down this aphorism number 1 and give the gist of aphorism number 1, that the mission or the duty, aim, object of the physician is to cure a patient, that is the restore the sick to health, and this is the most important thing which a physician and have to give emphasis on. And this is aphorism number 1 is the starting point of our journey. So this is this aphorism number 1 has been taken as the direction of what is the destination of a physician. So this is aphorism number 1, and thereafter you can explain each and every word of aphorism number 1 part by part, so that it is you can get a complete explanation of the aphorism number 1. Now describe the word mission of a physician. I have already elaborated it in this lecture, and that is why the lecture has been gone a little bit lengthy, but still if you go throughout this you can make a note of it. Now write short notes on physician, mission, health, sick care. We have already discussed it, and this is the, we can see that these are the commonest question from aphorism number 1. Another question is there may be a short note of the theoretic medicine, that is from the footnote of aphorism number 1. So this is what everything we can say, what we can explain about aphorism number 1. If you want to study more, or if you want to get more explanation, please WhatsApp me in this number, and subscribe this channel, so that with the bell icon, so that you may be notified for the next lectures. Thank you.